Hi, my name is John Rentick. I am a student at Pfeiffer University enrolled in the Bachelor's in Nursing program. I'm currently enrolled in Professional Nursing Practice and Communication, taught by Dr. Martha Bramlett, and we were asked to create a presentation about what we see as the future of nursing from our perspective and point of view. My perspective and point of view comes from one of being in nursing for 7 years, but I have seen what can happen in just 7 years. So what I kind of wanted to focus on was the next 20 to 30 years because I have a hard time thinking any further outside of the future than that. I feel like there's 5 key factors that are really going to impact the future of nursing. The first is our aging workforce. We have a lot of nurses who are reaching retirement age, and as we've seen in the last 5 years, a lot of them are leaving, and that's causing a shortage in our nursing workforce. Another factor is the aging baby boomers. Those people who are 60 and 70 right now, and will soon be 70 and 80. So that is going to increase the need in our workforce, and it's going to put a stressor on the healthcare system. Changes in insurance is another factor. The Affordable Care Act has done a lot of wonderful things. It's also proven to have a lot of challenges. One of the challenges is going to be that we have more and more insured people, which means we're going to see more and more of those people in our healthcare settings, which in turn means that we need a greater workforce. Chronic illness is a huge issue in America today. We are marketed to. There are a lot of commercials and advertisements and marketing pushing us to want to eat at McDonald's, to drink Coca-Cola, to do a lot of things that really are not healthy for us. We're not as physically fit as we once were. We have jobs where we sit and we're not as physically active. We have an increase in chronic illness at this point in time, and I think we're only going to see further and further increases in chronic illness until a point where population health and programs like that are getting out into the community to help educate people about chronic illness. I just think our entire society just needs to have a whole shift in the way in which we look at our own health. The last factor that I wanted to talk about was technology. I think technology will play a huge role in the future of nursing and in the future of healthcare. You know, anything that affects healthcare is going to affect nursing. I also wanted to add a 6th factor to my key factors, which would be waste in healthcare and financial viability and vitality. We have a huge amount of waste in healthcare, and I think that that's something that we're going to have to work on. And I think some of the changes that are taking place with insurance will force us to do that. So the first factor that I spoke about was the aging workforce and how that as the workforce begins to exit the system, we will have a greater need, a huge need for nurses. And in fact, in a paper called The Future of Nursing and Industry in Flux, written by Beverly Malone, PhD, and RN, who is the CEO of the National League for Nursing, she says that the U.S. will need to produce 1.1 million new registered nurses by 2022. So the challenge is, how do we make that happen? I personally think that we need to get into schools, K through 12 schools, and we need to show what nursing is and get them excited and interested in going into nursing, because it is a wonderful career that has so many options and potentials. And I don't think that you know, the kids who grow up always know all the potentials that are in nursing or really understand what options they might have. So I think we really have got to get into those schools and promote nursing and show what it really is. We also have to increase our nursing education and our nursing programs. I think it will take some legislative action that is already taking place now to develop more nursing programs. And at the same time, I think those nursing programs have got to be held to a very high standard. We can't just go producing thousands of cookie cutter nurses who really don't have the skills necessary to work in this very challenging environment. The second factor I wanted to talk about was the aging baby boomers. Of course, as I said, those 60 and 70-year-old people start to become 70 and 80. They're going to be having more and more health issues and chronic illnesses. Chronic illnesses put a huge strain on the healthcare system because they're chronic. They need health care quite often, and they need to be sometimes in the hospital quite often, and they need to see doctors quite often. So how will we deal with that? What are ways that we can deal with that? I think that technology has got to be used in the home setting to assist those people to get the health care they need via computers and technology. For example, someone who has chronic heart failure could very easily communicate with their healthcare providers via video, just as I'm doing right now with my iPhone. There's a lot of things that you could show in a video or with your iPhone or whatever type of technology that we could put in someone's home. You could, show if there was something wrong with you or if your feet were swelling. And so you can also record your heart rate, your blood pressure, and keep quite constant track of that. Doctors' offices and hospitals, personal care providers could receive that information and could review it on a such and such a basis, or receive alerts whenever there appears to be a significant change in that chronic heart failure person's weight, or that they report that there's some swelling in their ankles. The point is that it would allow us to act in the moment to help that person correct the problem before it becomes such a problem that they need to go into the hospital. Strain off of the healthcare system if we can keep people at home managing their own health more independently. So I think that you're going to see that, and I think that health insurance companies are going to, I hope, develop products and technologies where you would maybe even have a little station in your home. I know that they already do this a little bit with home health, in which on a certain basis, maybe daily, you check in, check your weight, check your heart rate, check your blood pressure, maybe pulse oximetry, report any weight gain, weight losses. And if there's an issue, a nurse can contact the patient, talk to them via video, and try to intervene before that patient needs to come into the hospital. So I think that's one thing to help with the aging baby boomers and the chronic illness issue. And I think that brings up another point, which is home health nursing. I believe that you're going to see an increase in home health nursing. Whenever we can keep the patient at home and intervene before the patient needs to go to the hospital, we're going to take a huge strain off of the hospital system. Because if we can prevent those issues from happening, we're not going to have x-rays, go into the hospital and have x-rays and blood tests, and potentially a lot of useless tests to try to find solutions to the problem whenever it could have been managed from home. And also that opens up a door for opportunity for education, that we have got to educate, that our society has got to be more in control of their health than they are right now. Changes in insurance. Obviously, thanks to the Affordable Care Act, we have more people who are insured. This causes more people to be going to hospitals and healthcare settings for health care, which is a good thing. At the same time, it does put a strain on our system. I think that changes in insurance are going to hopefully help with the medical, with the waste that is in healthcare, the waste in diagnostic testing, because I believe that the physicians are going to have to be held to higher accountability as to what tests they order and for what reason that they order them. I see a lot of duplication in orders. You can have a patient who was just at another hospital that got transferred to your hospital who just had a chest x-ray 2 hours ago. And we may or may not have access to that. So there's just so many areas that there's waste in healthcare that I think that the changes in healthcare, because they're changing the amount that we're reimbursed, we have to find ways to save money. To speak to that, I believe that there does need to be some legislative action to assist with that. For example, I took a patient to MRI recently, and there is a remote EKG, pulse oximetry, basically a remote telemetry monitor. It's about yay big. It sits on the desk and has a little antenna on the top. You can put the patient into the MRI machine and hook them up to EKG leads that are MRI compatible, and you can sit outside of the MRI pod or room and see your patient's heart rate, blood pressure, pulse oximetry, what have you. The MRI tech that was down there told me that they have 2 of those monitors, that they were refurbished and they cost $100,000 a piece. Not $10,000, not $20,000, $100,000 a piece. That is a shame. So I think we have to ask ourselves, why are we going to let people get away with charging that much for health equipment? You know, a hospital bed sometimes costs $25,000, $35,000, which is as much as a car. And you think about how many hospitals there are in this country and how many hospital beds. It's not as if they are it's not as if they only sell, you know, a few thousand beds a year. There's just so many areas in healthcare that we have got to have some legislative action to put some stops and some holds on the amount that people can charge healthcare companies for healthcare products. I think I've already touched on chronic illness. Of course, all of these issues are very interrelatable, but in regards to chronic illness, I just think that, again, legislative action. We are marketed to be unhealthy. We can sit down and watch 30 minutes of TV, and we will be bombarded with commercials from McDonald's, Wendy's, Coca-Cola, and at the same time, there will be a commercial for a drug. Ask your doctor about this drug. So they're marketing to us, telling us these easy solutions to our problems, just take a pill. And then at the same time, you've got commercials coming in saying, have you taken so-and-so? If you have, contact such and such a lawyer. So in relating that to chronic illness, there has to be a shift that cannot happen overnight. I believe that it will take 20 to 30 years to potentially make that shift happen. People have got to learn to be in control of their own health. I believe that the companies that we work for need to promote health more. You know, if you look at other countries and the time off that they have and the stressors that they have, we have very high stress levels. We don't have a lot of time to get things done. That leads us to eating unhealthy and not getting exercise, which leads us to needing the pills and needing the health care. So in regards to chronic illness, I think that we're going to have to educate, and we're going to really have to change the way that our country views health. You know, I believe that starts in school. I believe that we have got to get programs out there into the schools that really do teach and show what chronic illness is, what causes chronic illness, and what you need to do to prevent yourself from those chronic illnesses. So now we can talk about technology. I've kind of incorporated an aspect of technology in all of the other key factors that I've discussed. But I do believe that technology will play a huge role in the future of healthcare. We have seen a huge change just in the last 10 years in technology related to smartphones and tablets and things of that nature. So, you know, you see a lot of people now wearing their Fitbits that tracks their heart rate and their sleeping patterns and their activity patterns. I think as that technology advances, we're going to have the potential to maybe see EKG, pulse oximetry, maybe even monitor where and what you eat and where you shop. Sounds a little scary, sounds a little invasive into your life. But I think that there'll come a time that insurance companies will offer lower rates and things of that nature for people who participate in programs like this. And I think we're actually already seeing that a little bit. I know that some flexible spending accounts are paying for people's Fitbits. And so as far as technology within the healthcare setting, I believe we'll continue to see more and more advances. In the last 20 years, we've had so much advances in imaging, and I think that that's going to be a big help. Less invasive types of diagnostic procedures that will hopefully, in the end, cost less and prevent unnecessary treatment. Also, I think that we're seeing more information about nanotechnology and the ability to inject a very small microscopic type of robot into the bloodstream that could potentially treat and kill cancer. So many different things like that are really going to change the methods in which we diagnose and treat people. So I think the big question here is how do all of these factors affect nursing? So first of all, I wanted to talk about the workforce. If we have a decrease in our workforce, it's going to change our job roles. As people are asking us and wanting us to practice more and more at the top of our license, fully within our scope, I think we have to find ways to really practice within our scope. And I think that's very challenging. Or the unit that I work on is a critical care unit, and about 3 years ago we added CNAs to. I don't think that it was really beneficial or helpful in really allowing us to practice at the top of our license. I think it was a good try, and I think that's what you're going to see is a lot of different changes and attempts to get nurses to practice at the top of their license, to make it work, to make it effective, to make them efficient. So I believe that us nurses are going to go through a lot of changes in the next few years until a healthcare system is really able to get it right and be a leader and a model for other healthcare systems. So the aging baby boomers and the increase in chronic illness is going to increase the need for home health nurses. And I think that we definitely are going to have to find ways to make home health nursing more attractive, because it doesn't seem like a very attractive job for many. I think incorporating that technology into homes so that the home health care nurses are not always going and driving directly to the patient, it saves time and saves money, and to some degree decreases that negative idea that nurses have about home health and not always really being comfortable going into people's homes all the time. And I think that if nurses were able to engage in that higher technology and communicate with people more via video conferencing, I still think that home health nurses need to go and actually see the patients. But I don't think that we don't need to see them as often in person. So I think that's a huge change that we might see. How do the changes in insurance affect us? Well, the main thing being preventative. We are seeing, and we know that we're going to continue seeing more preventative health strategies such as population health. That's going to offer a lot of different jobs in population health. More about changes in insurance. I think that us nurses have got to be advocates for decrease in waste in healthcare. I see all the time so much being trashed and thrown away. A lot of times because nurses and CNAs and other ancillary staff have so much to do and have so much on their plate that it's more effective for them to throw something away than it is to really do the correct thing and try to save it. Lots of waste in overly used, unnecessary diagnostic testing that needs to change. And I hope also with a change, with more people being insured, that although they'll be using our healthcare systems more, they'll be using more primary care types of healthcare opposed to actually coming to the hospital when they finally reach that point that they're so sick that they have no other option but to come to the hospital. And also, hopefully, with more insured people, we will have less write-offs from the healthcare companies will hopefully not have to write off so much cost, and hopefully we'll not have to charge other people so much more to make up for the lack of the people who don't have insurance. I think nursing in the next 20 to 30 years is going to be extremely challenging. I believe that healthcare companies and the administrators of those healthcare companies need to get nurses really involved in the leadership and in the decision making, because I don't see that. I don't feel that anymore. I don't see that shared governance of nursing the way I've heard it used to be. I've just never experienced that. So many changes take place, and nurses are not consulted about their opinion or their thoughts, and we're the ones on the front lines. We know what works and what doesn't. We're experts at being efficient and prioritization and decreasing legwork for ourselves. We know what works, and we need people to listen to us, so that we're satisfied within our jobs, and so that we don't lose more and more people. Because I really am afraid that there's so much being put onto nurses at this point that it really is having an impact on their perception of their job and how happy they are in their role. Nurses need to get involved. They need to get into, as some people say, into the boardroom, and into legislative processes, and not just be someone who doesn't speak up and who doesn't express what we need. So to summarize my ideas about the future of healthcare, I think that every single change that affects healthcare has a huge impact on nursing, because it is nurses who implement the changes. When there's a new technology, it is nurses who have to learn the technology and implement the technology. Whenever there is a decrease in the nursing workforce, it is us that has to deal with and find ways to manage that lack of staffing. Changes in insurance affect our jobs directly, because if it changes the reimbursement, then it's certainly going to change our jobs, because with less and less reimbursement, we have to find creative ways to save money and still provide effective healthcare. So in the end, I think we're going to see lots and lots and lots of change. I think that we're going to see a lot of change in the next 20 to 30 years, and I think nurses really are going to have to get on board and understand that change is necessary to help to learn from trial and error, to find out what works and what doesn't. Because you can implement something and it doesn't work, and you have to go back to the drawing board and start over. So I just think there's going to be a whole lot of change. There's going to be a lot of technology, and there's going to be a lot of new potential jobs and opportunities for nurses. Thank you.